Understanding the definition of asthma is crucial for understanding how it affects oxygenation. The narrowing of the airways caused by inflammation and hyperresponsiveness can impede airflow, leading to decreased oxygen intake and potential hypoxia. Good day everyone, my name is Sally G. Martinez, a Section D nursing student, and I am with my partner, Miss Mercy O. Sarce, a Section B nursing student, and we will be discussing asthma and status asthmaticus. So today, we will delve into the complexities of asthma, which is a common respiratory condition that affects millions worldwide. Asthma is a chronic inflammatory disease of the airways characterized by recurrent episodes of wheezing, breathlessness, chest tightness, and coughing. So let us first discuss the fundamental definition of asthma. So according from the Global Initiative for Asthma, asthma is a heterogeneous disease usually characterized by the chronic airway of inflammation. So this chronic inflammatory disease of the airways are caused by airway hyperresponsiveness, mucosal edema, and mucus production. So these factors contribute to the hallmark symptoms of asthma such as wheezing, difficulty of breathing, and coughing. So in essence, asthma is a condition where the airways become overly sensitive and inflamed, meaning it leads to the narrowing and obstruction of the airways, which significantly affects a person's breathing effectively. So the key points are asthma is a chronic inflammatory disease of the airways. It is characterized by airway hyperresponsiveness, mucosal edema, and mucus production. Now let's move on to the prevalence of asthma. So the slide provides data of the prevalence of asthma in both the United States and in the Philippines. So in the United States, approximately 19 million adults have asthma, and it accounts to 3,564 deaths in 2017. So of these adults, 35.2% have intermittent severity, while 64.8% have persistent severity of asthma symptoms. In the Philippines, according to the World Health Organization, 12% of the Philippines population of 90 million have asthma. So the Global Asthma Report estimates that approximately 11 million or 1 out of 10 Filipinos suffer from asthma. So despite this high prevalence, 98% of the Filipino people have asthma patients and continue to lack proper treatment. So the high prevalence of asthma in both the United States and the Philippines highlights the significant public health burden of this condition. The data also underscore the need for improved access to diagnosis and treatment, particularly in the countries like Philippines, where a large proportion of patients lack proper care. Let's move on to the types of asthma. So there are two types of asthma: the atopic asthma or the extrinsic asthma, and the non-atopic asthma or the intrinsic asthma. When we say atopic asthma, the triggers of this are by allergens such as pollen, dust mites, or pet dander. The immune system's response to overreaction. As the body's immune system overreacts to these allergens, it causes inflammation in the airways. While non-atopic asthma focuses on triggers that are not directly related to the specific allergens. So this means it can be triggered by other factors like exercise, cold air, or certain medications. So understanding these common types of asthma is important for tailoring treatment plans. So atopic asthma again requires a focus on allergen avoidance and anti-inflammatory medications, while non-atopic asthma may require different approaches to identify and manage the triggers. Now let's move on to the other types of asthma. So asthma can manifest in various forms, meaning they have their own characteristics and specific triggers. So understanding these different types of asthma is essential for tailoring specific treatment plans and manage symptoms effectively. So first is seasonal asthma. So from the name suggests, seasonal asthma is triggered by the allergen that are prevalent during specific seasons, just like pollen or mold. So this type of asthma often manifests during particular times of the year, aligning with the seasonal presence of these allergens. Next is childhood asthma. So this type of asthma is often diagnosed in childhood, but it may improve or resolve as the individual grows older. So some children outgrow childhood asthma, while others may continue to experience symptoms into adulthood. Next is brittle asthma. So for brittle asthma, it is also known, or it is a brittle asthma is a old-fashioned term for difficult or severe asthma. So it is characterized by unpredictable and rapidly worsening symptoms. It requires careful management and close monitoring to prevent severe exacerbations. Next is the exercise-induced asthma. So this type of asthma is triggered by physical activity, often occurring during or shortly after specific exercises. It is caused by the drying and cooling of the airways during exercise. So next is occupational asthma. When we say occupational asthma, it is an asthma that develops in individuals exposed to specific irritants or allergens in their specific workplace. So these triggers can include chemicals, dusks, or even fumes. Next is the asthma COPD overlap syndrome, or the ACOS. So the ACOS occurs when an individual has both asthma and chronic obstructive pulmonary disease, or COPD. This is a combination that can lead to more severe symptoms and complications. So the last type of asthma is the eosinophilic asthma. So this type of asthma is characterized by the elevated levels of eosinophils, which is a type of white blood cells in the airways. So these eosinophils contribute to the inflammation and airway narrowing. Now let's proceed to the main categories of asthma triggers, which are the allergic and non-allergic. So for the allergic triggers, these are allergens, which are the common allergens includes dust mites, pollen, mold, and pet dander. So when individuals with allergic asthma are exposed to these different types of allergens, their immune system overacts, which leads to inflammation and airway narrowing. While non-allergic triggers contributes to external factors of the environment, factors like factors like exercise, stress, illness, and weather that can trigger asthma attacks in individuals who are sensitive to them. So these triggers can directly irritate the airways or induce the changes in the body that contribute to asthma symptoms. So let's proceed to the clinical signs and symptoms of asthma. So always remember that there are three most common symptoms of asthma, which are coughing, dyspnea or shortness of breath, and wheezing. In some instances, cough may be the only symptom. An asthma attack often occurs in night or early morning, possibly because of the circadian variations that influence airway receptor thresholds. So these symptoms are a result of airway obstruction, which can be caused by inflammation, mucus production, and bronchoconstriction. So first is a cough. Cough is the most common symptom of asthma, often accompanied by the production of mucus. It is a reflex mechanism to clear the airways of irritants and mucus. Next is the shortness of breath. It is another hallmark symptom of asthma. It occurs due to the difficulty in breathing caused by narrow airways. Then the last most common symptom of asthma is wheezing. It is a high-pitched whistling sound heard on expiration. It is caused by the narrowing of the airways, which creates turbulence as air passes through. Now let's proceed to the assessment and diagnostic findings in asthma. So this outlines the key components of the assessment and diagnostic process for asthma. So let's discuss the highlight of this topic, which is the pathophysiology of asthma. So the pathophysiology of asthma is a complex interplay of genetic, environmental, and immunological factors, leading to airway hyperresponsiveness and inflammation. So first, we have the predisposing, the causal factors, and the precipitating factors. For the predisposing factors, we have atopy, which is a genetic predisposition to develop allergic reactions, including asthma. So individuals with atopic asthma are more likely to be allergic to specific allergens. Next is female gender. So women are more likely to develop asthma than men, although the reasons for this gender disparity are not fully understood. Next is respiratory infections. Frequent respiratory infections, especially in early childhood, can increase the risk of developing asthma. So for causal factors, we have the exposure to indoor and outdoor allergens. Exposure to allergens like dust mites, pollen, mold, and pet dander can trigger asthma attacks in susceptible individuals. While occupational sensitizers, these are exposure to occupational allergens such as chemicals or dusts that can lead to occupational asthma. Next are the precipitating factors. We have respiratory infections, which are viral or bacterial infections that can exacerbate asthma symptoms. Air pollution, exposure to air pollutants such as particulate matter and ozone can irritate the airways and trigger asthma attacks. Next are the active or passive smoking. Smoking is a significant risk factor for asthma and can worsen symptoms. Then other factors such as stress, exercise, and certain medications can also trigger asthma attacks. Now, with these factors, this leads to an immune response. It is immune response or an exaggerated response. So individuals with asthma have an exaggerated immune response to allergens and other triggers. This response involves the activation of T cells and B cells, leading to the production of the IgE and antibodies. So with the exaggerated response and production of IgE antibodies, these IgE antibodies binds to mast cells and basophils, which triggers the release of the inflammatory mediators. Then leads to the release of the mast cell granules. So the release of these mast cell granules contains histamine, leukotrienes, and prostaglandins, which nagko-contribute sa airway inflammation and bronchoconstriction. Now with these factors of the immune response, it leads to the pathophysiological mechanisms such as the early phase response, delayed phase response, and airway remodeling. So for the early phase response, the immediate response to allergens involves bronchoconstriction, increased mucus production, and vasodilation. Then for the late phase response, this phase involves the recruitment of inflammatory cells such as eosinophils and neutrophils to the airways. And lastly, airway remodeling. The chronic inflammation can lead to structural changes in airways, including thickening of the airway walls, increased blood vessel growth, and the development of mucus-producing glands. Then this leads to the clinical manifestations of asthma, such as the shortness of breathing, which is a difficulty of breathing that is common symptom of asthma. Coughing, often with mucus production, is another frequent symptom. And lastly, wheezing, which is a high-pitched whistling sound heard on expiration caused by narrowed airways. So for the assessment, first is the medical history, such as symptoms, triggers, family history, and medication use. For symptoms, a detailed history of asthma symptoms, including wheezing, shortness of breath, coughing, and chest tightness. Triggers, identification of potential triggers such as allergens, irritants, or respiratory infections. And for family history, a family history of asthma or other allergic conditions. And lastly, medication use, review of previous current medications used for asthma or other conditions. The spirometry. It is important because the spirometry helps measure how well the lungs inhale and exhale air. Next is the peak flow meter. It is a portable device used to measure the maximum speed of exhaled air. While allergy testing, it is a skin prick test or blood test to identify allergens. Next is the methacholine challenge test. It is a specific test to assess airway responsiveness. Then the next one is chest x-ray. This is to rule out other conditions that may be causing similar symptoms. So the next test is the chest x-ray. This is to rule out other conditions that may be causing similar symptoms. Next is the exhaled nitric oxide measurement. This measurement helps to assess airway inflammation. Then next is the eosinophil count. This is to measure the eosinophil levels which can be elevated in asthma. Then lastly is the sputum analysis, which helps identify any underlying infections. Now we will proceed with the medical management for asthma. So in this slide, it highlights the two main categories of medications used for the management of asthma patients. So these two main categories of medications are the quick relief medications and the long-acting medications. So first are the quick relief medications. So the purpose of using quick relief medication is to treat acute asthma attacks and provide immediate relief symptoms. So there are several medications involved in the quick relief medications category. The first type is the short-acting beta-2 adrenergic agonists, such as albuterol and berbuterol as the most common. So they help by relaxing your airway muscles and opening up your airways. So next are the anticholinergics. So in anticholinergics, impratropium as an anticholinergic medication also helps relax the airways. So these quick relief medications are essential for managing asthma attacks and also prevent them from escalating into more severe episodes. They work rapidly to improve airflow and reduce symptoms, allowing patients to breathe more comfortably. Now, the next category or the last category is the long-acting medications. So the purpose of using long-acting medications is used to prevent asthma attacks and reduce the overall severity of the conditions. So the types of medications under this category are the corticosteroids. Inhaled corticosteroids are the cornerstone of asthma management. So they help reduce inflammation in the airways, preventing asthma attacks and improve lung function. Next are the long-acting beta-2 adrenergic agonists. So these LABAs work similarly to the SABAs from the quick relief medications but have a longer duration of action, meaning they make them more effective for preventing asthma attacks. Next are the leukotriene modifiers. So this type of medications helps or blocks the effects of leukotrienes, which are inflammatory substances that contribute to the asthma symptoms. Then next are the phosphodiesterase inhibitors. So these medications naman help relax your airways and reduce inflammation. Next are the immunomodulators. So for severe asthma that is not well controlled with the other medications, the immunomodulators may be used to target specific immune system pathways involving the disease. Now we will continue with the discussion of the surgical management for asthma. So while surgical management is generally not the first-line treatment for asthma, there are certain circumstances where it may be considered. So the first surgical management are the septoplasty and the turbinectomy. So the nasal obstruction can contribute to asthma symptoms by limiting airflow. So these procedures can improve the nasal breathing and potentially alleviate asthma symptoms. So severe nasal obstruction that is not adequately managed with medical treatments can be used for these type of procedures. Next is the sinus surgery. So chronic sinusitis can cause inflammation and the mucus production in the airways, exacerbating asthma symptoms. So the sinus surgery may be considered in case of persistent sinusitis. So the recurrent sinusitis with persistent asthma symptoms